Hey everybody, it's Katie Dale from Red Dirt Relief Fund. I'm here to talk about open enrollment because as of November 1st, there's an opportunity for anybody who does not have health insurance through their employer, or even if you have that option but you want to look at other options, to look for a plan on the healthcare exchange created through the Affordable Care Act. And the reason this is important to me is that since, Red Dirt Relief Fund is a nonprofit that was created to provide a safety net of critical assistance to Oklahoma music people in crisis. And what that really means is if a person who works in the music industry has an accident or an illness or some other reason that they can't work, that we provide financial assistance to try to help get that person back on their feet, or at least kind of help them tide over until they can get back to work. And from what we know now, 8 years in to this organization, is that a lot of experiences that music people have had that have created real struggles in their life could have been avoided or at least alleviated to some extent if they had had quality, even just any healthcare coverage, really. And so I met my new friend, Clay Ross, who actually is like an independent insurance advisor. And he has a company called Cardinal Insurance, and he understands all the ins and outs of this. He can help you connect with affordable, sometimes like zero out-of-pocket premium plans. He understands the exchange and all the options out there. And so I asked him to kind of jump on this with me to talk a little bit more about what some examples might look like, because I think the main message here is that healthcare is, first of all, accessible, and it can be affordable, even though you may not think it is. So I'm gonna hand it on over to Clay and have him kind of talk us through this.
Thank you, Katie. Okay, so what I run into a lot of times is people just don't think it's possible. They don't believe. There's a lot of misconceptions, a lot of outright falsehoods about ACA coverage or even private options that are out there now. Most of my service people pay under $50 a month, mostly restaurant workers, bud tenders, very similar. I mean, all 1099 work to musicians. I think the best thing that I can do to give you an idea of what I do and what's really out there is to give some real life examples that you guys can see. Okay, 74135, it's right in the middle of Tulsa. Let's say a single mom with 2 kids. That's what I worked up. So 3 in the family. She's making $22,000 a year. Okay, so if I'm gonna try and add the kids, most likely they're gonna be sent to Sooner Care, but I always try just to see if they can get a little bit better coverage at low cost.
Sure. And the coolest thing is that you have this kind of go around of the actual exchange. So it's really straightforward. But if
right.
People, as they like give you more details about what kinds of coverage they need, if they have particular prescriptions that need to be covered, then you can help them find that plan, right?
Exactly. I mean, if you go to healthcare.gov and try and do it, to even get to the real quote part, you really don't know anything until after you spent 45 minutes to an hour. You know, I mean, where it's 5-10 minutes with me on the phone, and it's really just zip code. How old is everyone? You know, what are you projecting for income next year?
This is pretty basic information right here.
Right. And then, I mean, well, and we can also, this allows me to pick, well, if there's a certain carrier you want, you know, we brought community care in. I can also look for specific doctors very easily. I just, I add them in right here. That way it'll only show plans that those doctors accept.
That's cool.
So most of it that I run into just comes down to like misinformation. This is a good example. Okay, so she's getting a subsidy, but you wouldn't think that somebody making 70,000 would still get any kind of a subsidy. Okay, but I just want to show you the plans that are available for her.
Okay.
At 22,000, so we've got plenty of $0 plans.
I mean, look at that one with a $550 deductible and $29 a month. That's crazy.
Right. And I thought this might be kind of a lot of musicians, 28-year-old guy, probably living down here downtown. Uh, I was figuring average income around $20,000. 20,000. Yeah, see, so it says no, none. Okay, so he qualifies for $337 a month with a cost sharing reduction. So
Wow.
that's how much it'll take his payment down. So he's going to have a whole bunch of zeros. Um, I mean, if he wants to get a really great plan, he can spend $50. You know what I mean, with
Hmm.
$5,300 deductible. So for the younger people, they're really not going to have a payment. I mean, it's catastrophic. They're not super worried about.
Sure. But
I
it's
mean,
there in case there is like some kind of crazy car accident or, a cancer scare or something, any of those things.
right. Even if you get one a $5,000 deductible, that's better than a couple million. And you know what I'm
Okay,
saying?
so
Yeah,
now I
absolutely.
guess next steps would be we're going to share your information and ways that people can get in touch with you so they can make an appointment to jump on the phone or meet you in person if people are down with that. Because I think we mentioned this, but you don't charge the individual anything for your help.
No, no, your payment doesn't change. You just get my assistance throughout. Well, not just enrolling, but throughout the year. I mean, it's going to save you 5 minutes on the phone with me. Save you a couple hours, I promise.
Yeah, and just with like some more expertise on what options are out there. So that's what we'll do. We'll share his information and keep you guys apprised, maybe share some more examples and in another video. And know that this open enrollment is open until December 15th. Is that right?
Yes, yes, it is. So